Hi friends, today onwards we are discussing the portions coming under the pharmacology as 5-minute session. This is a capsule format for the competitive exam as well as helpful for your studies. Let's start the trial together. First of all, we are discussing on the beta-lactam antibiotic. First of all, what is antibiotics? Antibiotics are the substances produced by the microorganism which selectively suppress the growth or kill other microorganisms at very low concentration. In here, we are discussing mainly on the penicillin. The penicillin is an example for the bactericidal antibiotics. Acticidal and bacteriostatic antibiotics are the cidal means killing and static means which will control the growth of the organism. Today we are discussing on the penicillin antibiotics. Penicillin are 6-amino penicillinic acid derivative and is having a beta-lactam ring which is reason for the bactericidal activity. How do they work? The beta-lactam antibiotics bind to the penicillin binding protein and is unable to cross-link the peptidoglycan chain, and this bacteria which will become unable to synthesize a stable cell wall. As a result, the bacteria get lyse. These are the structure of beta-lactam antibiotic, that is penicillin and cephalosporin, and this portion is the beta-lactam ring, and by this mechanism the penicillin acts. Here, the penicillin which will inhibit the transpeptidase enzyme, which will block this transpeptidase enzyme and causes the lysis of bacteria. Going to the penicillin form, there are different forms of the penicillin and available. Penicillin 5, that is phenoxymethyl penicillin, which is acid labile and penicillin susceptible. Next is methicillin, clofsaxilin and oxacillin. These three forms are penicillinase resistant. Next is extended spectrum, that is ampicillin, amoxicillin, carbapenicillin and piperacillin. And this forms among this the ampicillin which will causes the absorption decreased rate is food is available. Next form is penicillin G, that is pencyl penicillin, which is acid labile and penicillinase susceptible. Come to the interaction, there are mainly 4 interactions resulted with this penicillin. First one is penicillin with the probenecid. That is penicillin in the organic acid excreted by the tubular secretion which will inhibited by probenecid. This will result the prolonged action of penicillin. Second interaction is penicillin with the benzathine and procaine organic bases which will causes the depot formation which will act the prolonged action of penicillin. Third one is the ampicillin interact with the oral contraceptive which will cause the failure of contraception. Fourth case is hydrocortisone which will inactivate the ampicillin if it is mixed in IV. Going to the adverse effect, mainly 3 adverse effects reacted with this penicillin. First one is thrombophlebitis, that is the pain and inflammation at the site of injection. Second is hypersensitivity reaction and anaphylactic shock may be there. And third one is gyrus eczema reaction, which is seen in syphilitic patient, symptomized by the shiver, fever and myalgia, and this can be reduced by the use of aspirin and sedation. Afford relief can be seen in this reaction. Next is the beta-lactamase inhibitor, which will resemble the beta-lactam antibiotic structure. 3 important beta-lactamase inhibitors are there. This will bind to the beta-lactamase and protect the antibiotic from the destruction. First one is clavulanic acid obtained from Streptomyces claviculosis, which will prevent the degradation of beta-lactam antibiotic. It is a suicidal inhibitor. It is given under the brand name of Mentin. That is the combination of amoxicillin plus clavulanic acid. Second inhibitor is sulbactam under the name Unacin. It is a semi-synthetic beta-lactamase inhibitor related to the clavulanic acid. That is the combination of ampicillin plus sulbactam is Unacin. And third inhibitor is tazobactam. Combination of piperacillin plus tazobactam is given as antibacterial. By this, come to the end of the session. I think this is helpful for you. If you find helpful, please subscribe, share and support. Thank you for watching. Thank you once again.